Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala barakatuh. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Alhamdulillah, we continue with our approach of positive Islamic cognitive behavior therapy for anxiety, and today I'm going to give you some overview from our book, alright, of how we're going to do the Pi-CBT treatment. So if you go to our book, you can see that this Pi-CBT treatment techniques for anxiety, and there are a few pointers that I'm going to give you. Number one, when we talk about treatment for anxiety, we have to have the examining the evidence for and against a negative thought. I have given you the error in terms of unhelpful thinking approach, which I have given you in the previous video, the 12 unhelpful thinking style that is actually affecting you in terms of both depression as well as anxiety. So first and foremost, after the diagnostic, we have to do some sort of examination with our client. Alright? For example, the therapist set to challenge the patient's belief by asking questions such as, for example, you can ask questions like, how do you know that you're going to die when you have a panic attack? Because when you are hyperventilating, you feel like collapsing and so on. That could be your fear of maybe a heart attack or a situation that you're going to have stroke or whatever it is. That exacerbate the whole problem. So you have to slowly, gently question this idea. Asking the person, okay, how do you know they are going to die when you have a panic attack? And if they had already had episodes of panic attack before, then you can ask him, you haven't died before. When you have a panic attack before, you didn't die. It goes through a very severe problem for 10-15 minutes. After that, within 2 hours, you're back to normal. All right? So how can you know that what it feels like dying, the feeling of dying, is actually just a precursor to a panic attack, anxiety problem that, inshallah, with the right therapy, you can overcome it. Okay, so those are issues that you have to slowly, gently elucidate it from your client. You also can develop scenarios for the patient. For example, the patient would consider an alternative scenario and ask him or herself, for example, how much do I believe I'm going to die when I'm having a panic attack, and how much do I believe it now? So after the episode is over, and when they come for the next session, they have gone through that whole episode of panic attack and the feeling of dying. At that point, they may have, say, from the scale of 1 to 10, they think that it is 10, they are going to die. Now, it is 1. So that means they have overcome, to a certain extent, understand that this is just a misinterpretation. Why do I misinterpret the feelings that make me think that I'm going to die? So you can ask him or her that question. Why do you do that? Alright? And then gently ask him, how then can I control them if I have another attack? So I have given you the other tips earlier on of the 5 minutes approach, in which we can do the breathing technique as well as the 5-minute approach to overcome panic attack, which I have given you in the previous video. Number 2, you have to work out, when you talk about Pi-CBT, you must do a lot of reality checking, reality testing with your client. The therapist asks the patient to test the ability of his or fear of panic attack or anxiety. For example, identifying and rating it in terms of belief on the scale of 1 to 10 or 1 to 100. So each and every of the unhelpful thinking style, you can then sit down and then ask him or her to rate at the moment of calmness, when they are calm. Not at the moment when they're having this severe attack. That will be very, very difficult. Or during that discussion, suddenly they may have a trigger, all right, because of some episodic situation in the past. Then in that case, you should calm down, move away from it, and only move on towards this reality testing by gently elucidating the issue that is causing the panic attack. And then working out what him or her can predict from that situation, and devising a homework project to test out the fear. That means you develop a guideline in which the person would be able to have some homework to be able to reflect and think and find middle ground of overcoming their anxiety and their problem by giving them the right thinking skills. All right. Number 3 is when we talk about anxiety, we have to work on success therapy. That means we are giving them a progressive direction towards overcoming the anxiety or panic attack. So what you do, you set targets to complete routine activities, thereby encouraging new habits to form. Just like I've given you in the previous video, for example, they're all the time having this fear and worry, slowly bringing them out, for example, by having some time with the family, some time with the children, some time for exercising, some time walking in the park, hiking, swimming, activities, physical activities that will keep them occupied, and slowly develop habits like reading, habits like spending time with friends over coffee or tea, going to the cafe and things like that. So you are giving them a varied experience so that they will not be bogged down with the anxiety and panic problem. All right. Number 4, I have mentioned also, it is very important in Pi-CBT that you keep a diary, keeping a diary. So you have a diary in which to help track the client's progress and the inevitable ups and downs, because you'll have the ups and downs, and we have this tracking system. We have also the rating system that you built into the diary. All right. Divide each diary entry into segments to make it easier for them to complete. The timekeeper diary records specific daily times and activities relating them to their emotional state, whether it is a 1 or a 5 or a 9, their emotional state, whether it's positive, okay, or negative, positive or negative, which are the other way around, 1, 5, and 9. All right. And after the session of Pi-CBT, you find to give them more and more rational response to their challenges as they face this anxiety problem. A diary may also include rating activities on a scale of 1 to 5 in terms of the pleasure they are having, and to 1 to 5 or 1 to 10 to the extent which they bring successfully completed in accordance to the sense of mastery and pleasure. Alternatively, they also can record their thoughts, feelings in the diary that is catching the thoughts, whatever that is coming. In this process, the patient monitor his or her feelings, catch the accompanying thoughts, and record them in their thought diary. All right, this is another approach that you can teach them. And then as you review, as you are the counselor or the coach, you review that and slowly bring them gently towards a more rational response. Number 5 is cognitive rehearsal. You have to do a lot of cognitive rehearsal in your Pi-CBT session with them, because you're going to have between 10 to 20 sessions, each about half an hour to 45 minutes or 1 hour, depending on how the situation is. And you must have this target. The exercise involves the role play of anxiety, provoking activities with the help of the therapist, this cognitive rehearsal, role play, all right, the downward arrow technique, the behavioral activation technique, and so on, which I have given in my previous video for depression. You can more or less reorganize it for anxiety, and inshallah, if I have the time, I will also give you this various role play technique for anxiety. Okay, the patient imagines him or herself trying to do things that he or she fear that are beyond him in order to help identify the various mental blocks. The therapist may take them through the role play step by step, asking what you'll be thinking about this at this time, what did you do that is most dear to you now. The therapist will ask patient to write down those negative automatic thoughts, identify the distortion, and think of an alternative rational response. So rationalizing the response, there is a homework here. Rationalizing response, for example, like a person is having panic attack because he or she is going to give the first presentation as a lecturer. So the thought-provoking event could be presenting the first lecture, the feelings, anxiety, fear, concern, panic, negative thoughts, oh, I'm going to fail. That is that feeling. Rational response should be, oh, it's only natural to have some sort of nervousness. And then the result, patient re-evaluate his or her belief rating from a scale of 1 to 10. So this is how you develop, and also you have to give them the away situation where they try to develop these negative thoughts, progressive negative thoughts. For example, like, oh, if I'm going to fail, then I'm going to lose my job as a lecturer, I'll embrace my family, then I will be jobless, and then I'll be on the streets, and so on and so on. So these are the negative distortion, and you must teach them how to have a positive rational response in your counseling, in your coaching, and in your application of positive Islamic cognitive behavior therapy to help your client, and use this as a basis of developing a very science-based, empirical-based approach towards achieving and overcoming anxiety. And remember, in Islam, we integrate at the 4 levels. I have exercises of the forms, the spiritual, emotional, mental, and physical activities forms that you can download or take it from this book. And from then you can work out an approach that is holistic, using the full range of human capability within the framework of positive Islamic cognitive behavior therapy, inshallah.